So Christian, you're an ECP within Shropcom. Tell me a bit more about what that means.
I am. So, ECP is emergency care practitioner. I work out of a minor injury unit within the community, specifically Ludlow. We've got a few around the county, but that's where I spend most of my time. As an emergency care practitioner, we provide a walk-in service for the public, specifically for minor injuries, whether that be a cut to a finger, to a broken bone, ankles, wrists, anything like that really, burns. We see a myriad of things that people come in with, and I will be the first and sometimes the only clinician that will see them depending on the injury, and I will look at, assess, create a management plan for that injury, refer on to specialties if needed, or do everything in-house, wrap them up and send them on their way, really.
And your background as a paramedic with the ambulance service, so was that sort of a natural progression for you?
Yes and no. I mean, yes, in that it's a development in clinical knowledge and clinical skills, but it's very different. Obviously, working as a paramedic on the road, you're just driving around most of the time, giving care to people in their house or in the public space, and taking them somewhere if appropriate or if not. But to be sat still and patients come to me in minor injuries is very different.
So was there much extra training you had to do?
Yes. Well, I mean, it was a specific minor injury module at university. I did a foundation degree in paramedic science originally, and then I have done a top-up degree, bachelor's in emergency practitioner.
Okay.
So that includes minor injuries and minor illness, specifically, and that's just 30 credits module at university, a couple of exams. Competencies, I went and worked in an A&E department in minor injuries for a few months, with a named mentor, developed my skills under supervision, and deemed clinically competent at the end of it.
Excellent. Was that something you self-tasked and self-funded, that course?
Yes.
Okay.
Yeah, I did it off my own back whilst I was working full-time for the ambulance service.
Excellent. Okay.
I did it in my spare time, over a number of months.
Yeah. So my background's also from the ambulance service. I'm aware that they don't offer that kind of extended training to facilitate us going into other paths, do they?
No.
So there's quite a lot of self-motivated, self-funded training at that point.
Absolutely.
And what's your experience once you're into the community of that? Is there more opportunity for training and funding?
Absolutely. Within Shropcom, they have laid on a plethora of different courses and opportunities to develop clinically, expand my knowledge in various different ways. I've done X-ray interpretation courses, I've done wound care management courses. They do allow us to go and all over the country. Actually, I've been down to Milton Keynes, up to Manchester, London, doing different courses to develop as a clinician and help provide a better service for our patients.
Great. You still work with the ambulance service, don't you?
I do, 1 day a week.
Fab. Any of your skills from community transferable back into your patient care?
Absolutely.
Yeah.
I definitely am able to take my skills from here, working in minor injuries, to the ambulance service much more effectively than the other way around. I definitely can, with the extended knowledge in minor injuries that we go out to on the road on the ambulance, it does allow me to understand injuries and the appropriate management plans from a different perspective, and know what community services are available and would be more appropriate for that patient than going to hospital.
Yeah, excellent.
Yeah. So Andy, you're a paramedic within Shropcom. What's your role?
Okay, I have two roles within Shropcom. First and foremost, I joined as a paramedic on urgent care. So 2-hour urgent care response is part of the government's model to get patients seen in their own home a bit quicker than the ambulance service can deliver at the moment, and relieve some pressure on A&E. So when I originally joined Shropcom, I was with a team called Rapid Response. I'm still with them 2 days a week. So that involves going out to see patients who have been identified as in crisis by either their GP or their carer, or they've self-referred. And that's generally people who've got existing medical conditions that have gotten worse, or have a new medical condition, everything from having a fall with some kind of medical reason behind it, through to, for example, an exacerbation of heart failure or a COPD, anything like that we take in. So it's a very broad remit. And then we can feed directly into community services once we've managed that crisis point. So if the patient needs to go into district nursing care, or needs more input from their GP, or needs, for example, a podiatrist, anything like that, we can make those referrals directly. So we're within the same system, it's much easier to do that, whereas with the ambulance service, it's a separate system, and that referral has to go through a single point. It's a little bit discombobulated, a little bit convoluted, whereas we can manage a lot of fingers and a lot of different pies within Shropcom itself. So that's 2 days a week, I'm still doing that. And then 3 days a week now, I'm also the resuscitation officer for the trust, which is it's sort of a semi-governance and semi-training position. So I lead on the training for all resuscitation, so basic life support and immediate life support, but also supporting all the equipment needs and the audit needs within the trust for making sure that our resuscitation services are safe and sustainable. So that's quite a challenging role. Well, I have a background in sort of management and audit, and I quite enjoy that side of things, as well as the training side, which keeps me out and about and gets me meeting people within the trust, and lots of different backgrounds as well. So I would get involved with everyone from emergency care practitioner down to HCAs through to podiatrists. Everyone who's involved in patient care has some kind of need for skills in resuscitation. So that's really good. It's a really good overview of the trust that I need.
Lovely. Nice. And how long have you done these roles?
So I've been with Rapid Response. I joined Rapid Response about 18 months ago, moving over from the ambulance service. I was the first full-time employed paramedic in the trust in the Rapid Response role. We already had ECPs like yourself, but that's a very it's a very narrow direction, whereas the UCR, the urgent care paramedics, a very broad role. It's much more like the ambulance service. You never know what you're going to get. It's not just an injury it's going to present. It's a broader thing. And we've been working within the trust to build that as a more sustainable model to bring more paramedics in, because the nature of the urgent care response is that the paramedic role and the sort of way the paramedics think is very much in line with what we might be presented in terms of patient problems. So you've got a problem, go in and fix it. That's very much what paramedics do. And we support the nursing teams and the physiotherapists who work within urgent care to sort of identify those big problems and then facilitate a solution as needs.
Lovely. And what do you like best about your roles?
Oh, what do I like best about my role? So I'm a problem solver. That's my motivation in life, really. So with the urgent care paramedic, that is purely problem solving. That ticks all my boxes, really. To walk into a situation, to ask a patient what's wrong, to get an idea of their problem in the context of their own home, I find that important. And then to be able to deliver some kind of way out of that problem for them, that really does make me feel validated. That's, at the end of the day, I like that. That's what drives me. And then in the resus officer role, I get my validation pretty much vicariously from training other people to make sure we're providing that better standard. So there is a problem I've identified, which is that we can always do better at resuscitation and training, and my outcome is to deliver that better, and that's what I enjoy.
Lovely.
Christian, have you always worked as a paramedic?
I was a HCA, healthcare assistant in A&E, not for very long, but just for a bit. Before that, though, mental health. I worked with Shropshire Mind in the community for a little bit, and but other than that, hospitality.
Okay.
For half a decade running bars and restaurants. Although I must say hospitality does come into play a lot as a paramedic, especially in the community.
Lots of transferable skills in people skills.
Yes, and with mental health as well.
Yeah.
You know, when you go out you see people out in the community, it's in their environment or not necessarily a strictly professional environment, and you do have to manage people. You see people at their best and at their worst. It definitely helps to be able to talk and satiate and have a back and forth and achieve a goal together.
Definitely, my experience of having students in the ambulance service and in ShopCom is that those who can talk to people, who have that knowledge and skills to have a conversation, they do much better. It's much easier for them, isn't it?
Yeah, absolutely. Absolutely. It is something that I've said many times over the years with students on the road, and a couple of students we've had in minor injuries as well. Talking is 80% of the job, isn't it?
I completely agree.
You can learn the skills, you can learn the knowledge, you can learn the care pathways, the management for injuries, or when to refer, you know, pull on NICE guidelines, CKS, all these different things, and knowledge, sites and all this kind of thing to know what to do, but you really need to be able to communicate effectively with a person and get to the effective management together.
Yeah, absolutely.
Individualise everything as well.
Yeah, and that's something that's very hard to teach, isn't it? So if you haven't got those life skills in place before you start as a paramedic, that's the learning curve, isn't it? Really.
Definitely.
The clinical side, it comes naturally, but speaking is difficult. Yeah. Okay.
Definitely. For them to learn.
What do you like best about your role as a paramedic working within the community system?
I really enjoy making a little difference and also problem solving very much. The role of a paramedic, whether it be in the community, well, I'm sure with rapid response like yourself, minor injuries, we are limited to our resources. You know, whether we've only got certain equipment, we've only got certain investigations to hand. For example, we can do X-ray in minor injuries, but only within certain times and days. So having to work within these set parameters and do your best within it is quite good. It's quite enjoyable to be able to get things done, even with limited resources or time or whatever it might be. So I do enjoy that. But also the role within minor injuries, we do see quite quick differences. You know, I can be presented with a full thickness laceration to a hand, something like that, from a saw or some kind of debris or sharp implement, whatever might have happened. And they come in wrapped in a tea towel, bleeding, upset, worried about what's going on. And we go through a systematic approach to assess the wound, see what's actually gone wrong, what structures might be involved, if it's just soft tissue injury, if there's any bony involvement, through investigations like X-rays or assessments through movements and trying to see if there's any involvements of things like tendons, ligaments, and we can just tick off these things individually, one after the other, see what they've done. If there's no complications such as tendon involvement, then I can do things like clean the wound up, inject a local anaesthetic, so we can have a really good look at the wound, clean it, and then do some wound closure, whether that be steri-strips, wound glue, or sutures, sort of primary closure. It's very satisfying to, you know, have a patient walk in with a bleeding wound and then leave with some sutures all cleaned up, wrapped up, appropriate dressing applied, with a management plan in place for them to go and have the sutures out at the practice nurse or come back and see us again for a review. And also having imparted some wound care advice and knowledge on them so they feel confident that they know what to do if something doesn't go as planned, or it does, and they're happy with the plan, so they can get the best care and the appropriate management. So it's quite fun to get that all in place. And sometimes you can be the only person that sees this. You see it from the moment of injury, implement the treatment management plan, they'll go home, be happy, and the wound will heal nicely, and no one else even has to be involved. Shows the autonomy of a paramedic.
Yeah, I really like the way you described it, because it's so alien from what I do. You're speaking an almost different language. It's a very specialist role, isn't it, ECP? It's a very narrow field that you've gone down. I find that fascinating just listening to you talk about it, because your general paramedic practice, you don't do half of that stuff, do you?
No. It's a bit of jack of all, master of none, I think, in general paramedic. Yeah. We have to know a shallow knowledge pool about a broad spectrum of problems. But the emergency care practitioner does very much narrow that down, increases the depth of the knowledge in that specific field, and it's good. But also knowing the bottom of your, the depth of your knowledge is good, because if I get an injury that requires specialist intervention or referral to a specialist, then we know and are able to do that as appropriate. Yep. Whether it be orthopaedics up at the local hospitals, or something more specialised if we have something like a burn present that needs referral. Our closest burn specialist is a QE in Birmingham, so to liaise with the specialists via apps or phone or online referral tools, the myriad of different ways that lots of places like, is very interesting, and allows us to be part of the management of something that can be a lot more serious, that is out of our scope. But we can still have a vital role in it, and signpost these people to the appropriate care.
I think it's really interesting. I mean, you and I did the same course years ago, didn't we? And I think paramedic practice teaching since then has come a long way. I know they're doing some minor injuries and minor illness teaching within the degree now that certainly I didn't do, which is quite interesting. I wonder if they're looking to broaden the scope of the paramedic to allow them to go into more fields, because it's growing in primary care and secondary care, isn't it? Absolutely.
Just in the short time I've been within the service, since in the short time I've been a paramedic, the doors that have opened for us, the career pathways have increased tenfold probably. We can go down to in almost any area of the NHS now.
Yeah, even since I've joined, I mean, you're 8 years, I'm in 5 years in, and since I've joined, those doors have opened enormously. Like I said, I was the first in ShopCon to be taken on as an urgent care para, and that's only going to grow, isn't it? And I think our doors opening to ECPs and other paramedic roles in the trust are going to get wider and wider. It's really interesting times.
Absolutely exciting time to get involved, really.
And actually, I'm seeing more and more paramedics in primary care working with GP surgeries now, which is really interesting. Definitely didn't see that a few years ago.
No, absolutely. The general feeling of paramedics is that you become a paramedic to not necessarily work in hospitals, to be out in the community, to be autonomous and not necessarily work within a large multidisciplinary team and be able to do a lot yourself. But there's a lot of people going into primary care now. Yeah. So going back a little bit, what was your original motivation to become a paramedic when you were working as a HCA or mental health? Good question. In a way, I kind of fell into it. I thought, that looks interesting. Like I said, I started I did about 6-7 months as a HCA in A&E, just to break into the NHS, and obviously I had a lot of interaction with the paramedics there, had a bit of a chat back and forth. I did work in minor injuries in A&E quite a lot. I quite liked the wound care and x-rays and all that anyway. But yeah, having a bit of a back and forth with the paramedics to understand their role. I actually went out and did an observation shift on the road with a couple of experienced paramedics to understand what they did, go out and about within the ambulance service, that is. And I thought that looks quite interesting. I like being out and about, not stuck in one place. I like to think I'm resourceful and capable of pulling things together. It's a bit of a rough and ready role, really, paramedic, especially when you're in some of these places.
Yep.
Out in the public or in the fields or wherever you might find yourself.
Nothing quite like a night shift in the middle of a field, is there?
Absolutely, yeah. Raining, not enough light, getting your phone or head torches or whatever you've got available to actually see what you're doing. So yeah, I quite like that.
Good. All right. It's funny you should touch on that. It's kind of my similar motivation. I worked in manufacturing for 20 years before this. I was originally trained as a product designer. And then Brexit came along and I saw the writing on the wall for my company, because it was a small company that makes stuff in the UK and exports mostly to the EU. And that wasn't a good combination from Brexit. So I thought, I need something a bit more sustainable. And I've been a search and rescue volunteer for 10 years or so at that point. But it's that kind of, that working in the middle of a field, in the middle of nowhere, being challenged with yourself and pushing yourself. That's what I was interested in at the time. And just like yourself, I did a couple of shifts on observer shifts on an ambulance. I thought, you know what, I like this. This is kind of up my street. This is that kind of problem solving I really enjoyed. And I happened across the apprenticeship scheme that West Mids Ambulance Service were running at the time, still are, I believe. And I thought, actually, that's a really good idea, because you get paid rather than paying to do a second degree and accruing all that student debt. You know, it's not a great amount of pay you get through the ambulance service as an apprentice, is it? But you know, it's better than nothing. So I jumped on board that in, I think, 2018, beginning of 2018, and yeah, that immediate being on the trucks, learning from the paramedics and the techs who already work, rather than being in a university classroom teaching environment, that was the way I learn. And it was being out there in the field and just doing stuff and learning from the doing, and I really, really enjoyed that. And that's my take home. And when you said that a paramedic has to have a big toolbox and a shallow knowledge of everything and a big toolbox to deal with these weird situations, spot on. That's exactly what I think.
Absolutely.
And that does me well in urgent care, because you never know what you're going to get in rapid response. You never know. You know, we'll get untriaged calls from the ambulance service saying, this person's had a fall, can you go and deal with it? And when you'll get there, they'll be having a major medical episode that you have to deal with, and a panicky family and a dog, and they're fallen over behind the toilet and stuff. So all these complex things you have to manage, and I mean, that really does fire me up and get me going, because it's exciting. There's not many times you can go to work and be excited, is there? And get paid for it. It's great.
Absolutely. And for it to be different. You get something like a foal at home, but you can go to 100 different foals at home, and every single one would be different.
Absolutely.
Different places, different people, different people around, environments. It's all different, so it's definitely an environment that's going to keep you on your toes.
Definitely, definitely. I find that falls really interesting, because, as you said, there is no two falls the same, even the same person falling over twice. It's always going to be a different position, different injuries, different causes. It's a fascinating science, isn't it?
Absolutely.
Yeah.
So if people didn't want to do or weren't able to do the vocational course through the ambulance service, what would be their options? So
there's two options. One is the vocational course through the ambulance service. The second is to do a degree, paramedic science or paramedic practice, through university. So that's a level 6 qualification now. Unlike when you and I came through, when you could have a level 5, it's now mandatory level 6 for a paramedic, isn't it? That's a 3 or 4 year course, depending on where you do it and how much they put you into a placement. Lots and lots of places doing it now. There are at least 3 or 4 different universities working within our area here, and they are feeding students both into the ambulance service, and then we have short placements within Shropcom, don't we? I know we've got a couple of students coming through with urgent care at the moment, and I believe you have the odd student coming through in minor injuries as well. And I think that's a concerted effort by the universities to broaden the experience of those students coming through, and to say that there is a bit more than the ambulance service at the end of this. And I think that's quite wise. I would love that opportunity when I was coming up through to say, you know, do a couple of weeks with the GP, a couple of weeks of minor injuries, and that bigger understanding, because it's much harder once you're qualified and in employment to find that time to get that experience. And plus, fewer doors open for you, don't they, if you're paid elsewhere, and, you know, can I come and sit with you for a couple of weeks? I'm not a student, but can I come do it? It's a bit more of a different offering to, I'm a student, I'm learning, can I come and do it?
Yeah, absolutely.
But what I have found since I graduated is like yourself, I've done self-motivated onward study. So the first thing I did was a postgraduate certificate in leadership and management, just because that's my background. And one thing I have noticed about the NHS, if you're a mature student or coming through, is a qualification, an academic qualification, generally means more than life experience. They recognise it a bit more. So I wanted to consolidate my life experience into that qualification. So I did that off my own back, and that did open up a few doors, which was very handy. And now I'm being supported by the Trust to do a paramedic practice development level 7 course. And that I find is really useful because I'm the only paramedic within my urgent care sector. My immediate peer support isn't quite as good as it would be within the ambulance service or where there's more paramedics. So the backing of that course in terms of my own development, I find that really fundamentally important. But I have the backing from the Trust financially. They're paying for me to do that course. So, and they facilitate me going into places like minor injuries to do days learning there. So that's really good in terms of career development onwards. And I hope that closer link to universities as people come up through the level 6 and more placements will facilitate a bit more of a churning onwards through 7s, and then into specialist paramedic and then advanced paramedic and even consultant paramedic level. We don't have those within Shropcom yet, although ECP is broadly equivalent to specialist paramedic band 7, isn't it? It would be nice if in the future we could develop those pathways to allow, you know, the higher grades, the more experienced paramedics to come in. But I think that's work in progress. So we're not alone in community in not having those pathways yet, but we'll get there, I think.
Yeah, absolutely. Okay, so in your role in rapid response, when you do have students, how do you develop them? How do you support them? How do you help them develop?
That is a really interesting question. So when I joined Rapid, I did some training as a student mentor, effectively for student nursing, because there's far more student nurses come through Shropcom than student paramedics. And there was no transferable skills from the paramedic mentor course that we do in the ambulance service to bring across. So I'm kind of qualified as it is in mentoring student nurses, which is interesting. There's quite a lot of crossover. But then we're seeing more and more student paras come through, and they're generally short placements, and they're more of a dipping into what we do here and understanding, rather than teaching them anything clinical, rather than teaching them how to do the job. It's exposing them to what exactly we do and why we do it, especially in urgent care, because it's so broad, it's such a generalist role, and generally we're getting second year paras coming through, or occasionally first years. That's that broader understanding of just how diverse it is and how diverse their knowledge and background has to be for these undifferentiated conditions we're going out to see. So it could be anything from a cellulitis through to fluid on the lung through to a head injury, and you've got to have a good broad base of what to recognise and when to refer properly. And that's the kind of things you touched on, referral pathways earlier. Fundamentally important within community services is who's the bigger grown-up, who do we send these people to when we've reached the limit of our expertise, and these people still need to be safety netted onwards. That's been really interesting. And what about yourself within minor injuries? How do you guys support students?
So Generally, we just get them in, working with us. We don't tend to get paramedic students from universities very often. I don't know if they're doing them in hospital or whatnot, but we're not currently getting a flow of paramedic students. We get mainly nursing students, second year university nurses, things like that. So with those students, we'll take them into our room, as long as the patient's happy for them to be there, and they'll be able to watch us do everything from the diagnosis, investigations and treatments. And generally I'll explain what we're doing, why we're doing it, why it's most appropriate for this person or this situation, and just talk them through everything really, which usually tends to help the patients as well. Get them involved, get them to practice their history taking skills, communication skills, and we can get them involved in a lot of the treatments, the wound care. They can get hands-on with some of the wound care and management. Things like plastering is good to get them involved. We can do plaster casts for people with fractures, a lot of the wound care stuff, and they can practice the things like aseptic techniques and dressings and things like that. The paramedic students we do get tend to be qualified paramedics who are doing the extra module to become minor injury specialists. So they tend to be experienced paramedics anyway, who are just expanding their knowledge and skills. So obviously you're treating them differently, although they are students still. They're just students with a very different knowledge base and experience. So it's quite interesting to have to adapt to different students in that way. But it's good. I enjoy having students, to be honest. It keeps me on my toes, makes sure I'm up to date with everything, and makes me remember why I'm doing everything, what's most appropriate. So yeah, it's good to impart the knowledge, like you said before. I enjoy seeing a student develop and learn, and when they leave after spending some time with me, I like to think that they've learned something and they'll take it on.
Definitely. I completely agree with the whole I learn more from having a student, because you need to think things through, don't you, logically, in order to explain them. You need to fundamentally understand them. So that's actually why I enjoy the resource officer stuff, because I have to raise my own game in order to teach it. It's really interesting.
Absolutely.
So what are your top tips for students who come through?
Top tips? Absolutely throw yourself in, I think. Don't stand back and be shy. That's not something that paramedics will get very far doing. You need to get stuck in, really engage with the patients, the staff, every aspect as well. Ask questions. Ask questions is another. Don't be afraid to ask why. Why are you using that dressing? Why would you use that dressing as opposed to a bandage or whatever it might be? Just ask the question, even if it feels like it might be an obvious one. There's going to be a reason why we are doing something. So always ask, get involved. It can take a little bit of time to get the confidence sometimes, but communication, get involved and talk.
Absolutely, 100% agree with that. Communication is the most key thing for me. A student who's come through with life experience, who can talk to different generations and listen to different generations, is going to be leaps and bounds ahead of someone who's reticent to have a conversation. That conversational skills is right up there for paramedics, isn't it?
Absolutely. Any experience, even if it's voluntary, if you've got a couple of days spare, see if you can get involved with care homes or on the wards or anywhere in the community. You guys, rapid response, any of us, even outside of the official student pathway, just see if you can get involved some way. And it will help. It'll pay dividends in the end.
Absolutely.
Allows you to get that back and forth and that exposure to patients. And like you say, patients across the board. You know, you've got to behave very differently with a 2-year-old than you do with an 82-year-old. But it just gets you that exposure, allows you to understand what every situation needs and have an idea how to go about approaching it.
Yeah, all right, lovely. Thanks very much, Christian.